Welcome to the first edition of the online version of What Women Want. We want to empower you, enlighten you, and get you through unprecedented times right in the comfort of your own home. Today we have the privilege of talking to Senator Kasanga about mental health in these unknown times and the times of COVID. This conversation is powered by SBM Bank. Basically joins us from her home, up country. Where are you?
I am in Machakos County.
So you're back from Nairobi for 21 days.
Oh. No, my only luck is that I am just I'm actually at the boundary, like at the very edge of the metropolitan.
Oh,
so
brilliant.
I can't come into the city if need be. Yes.
Oh, that's good. At least if we need you, you'll be here. So, Senator,
Absolutely.
with everything that's going on, I know you're very big in regards to mental health, and mental health is something that I can see. It's the elephant in the room. Nobody really wants to discuss it, but it's going to be an issue. As it is, it was an issue. And I know, the president had said last year that he was encouraging the Ministry of Health to prioritize it. And I know that was with thanks to you for really pushing certain bills in Parliament. But I mean, now with what's going on in the country, people are being laid off, children are at home, we are stuck at home. What's the impact on mental health going to be?
Pinky, we expect a very escalated, or we can say a surge in the number of Kenyans who are suffering from mental health issues. As we were debating the bill most of last year, we were talking about World Health Organization statistics that had put 1 in 4 Kenyans suffer from mental health. I'm sure we shall see an increase in that number, almost to 1 to 2. Yeah, almost to 1 to 2 of Kenyans, given the fact that what we are going through now is going to affect us so adversely. If we're talking about financial issues that Kenyans are going to go through, we're already beginning to feel them. Just this morning, I had a lawyer friend of mine call me and say, what are we going to do with our staff members? I'm not able to pay my staff end of April. And that's a law firm. So how about, the casual laborer, the one who eats from hand to mouth every day? It's a serious situation, Pinky. And the one good thing I can see is that I have been made the vice chairperson for the COVID-19 ad hoc Senate team. And as you can imagine, the first question I have written a letter to the Ministry of Health is, what is your strategy towards mental health for Kenyans at this time? First, as we are going through this difficult time, and a little post the difficult time, because of the escalated number of cases that we shall see. What is the strategy? The government has not funded anything mental health, and that's why we were, fighting for the bill, because then we can be assured of some significant amount of funding going towards mental health. And this is the time the belly is really going to show, Pinky. The belly is really going to show. They've never put aside money for mental health. Even as we speak right now, I was speaking to Mathare, the deputy superintendent at Mathare National Hospital. I'm asking her, I hope Mathare has been made a center where they can collect samples for COVID and where there's an isolation and quarantine as well, because Mathare must be 24/7, in my opinion, given that it is the biggest caretaker for mental health patients, people who are currently living with, and expected new cases. And I was very disappointed to hear that they don't even have any protective gear. They have level 2 protective gear. They cannot collect samples. They've not been given the capacity to collect samples. And, that means they are exposing themselves to any new patients, or maybe they're not seeing anybody new. I still don't know about that. And I am aware there's a quarantine facility, I think one of the wards. And already we are seeing cases from quarantine who are breaking down, and they have been taken to Mathare. In fact, the day I spoke with her, she had one person who had broken down in a quarantine facility and had been taken to Mathare. And I asked her, is that person positive? Do you know whether they're positive of COVID or not? And they didn't know. So imagine you've been taken for somebody there and you don't have the capacity to handle them. So for me, that is a bit of a worry. And I will want to see the government make Mathare a place where they can collect samples for COVID, where they can quarantine and isolate. And the reason is simply because mental health services cannot come to a slowdown. There cannot be slowing down. It is as essential as everything else. It must be running 24 hours if possible.
I mean, if you think about it, Senator, there's so much trauma that everybody is facing. If you were traveling and you landed back at the airport and they told you to go in quarantine at a hotel that you had not planned for 14 days and then kept you there for another 14 days, you're traumatized, you've not seen your family, you're not sure if you're sick, you're not sure. And then for people who've just been told stay at home, someone like me, there's trauma because I'm now missing my, you're grieving your old life or what was. And then, of course, how we are behaving in front of our children at home, who will then go on to take this trauma and, live their adult life with it. So what is your advice to Kenyans? I mean, how can we be purposeful and intentional in regards to our mental health? Because it should be a priority.
Yes, I know. Mental health was a priority. I was asked this question and I was a bit at loggerheads because I am grappling with it myself. I think all of us are now equally grappling with this situation. How do I stay sane? How do I stay on top of myself? I have to wake up every morning. I have to remember to keep my routines in as much as possible. I have to continue with my exercise as much as I can, even if it's in my bedroom or wherever I can do it. You have to try as much as possible. And thank God for technology. You can call up a few friends and speak to them. So you're never really by yourself. You can pick a book. You can, watch one movie or two. You can read, write. In fact, the other day, I was seated with my daughters because now we are learning how to parent. We've not been parenting. Schools have been parenting for us. So now that I am parenting, I realized I had forgotten how to draw, and I used to be very good at drawing. So I'm picking up my artistic skills again and sitting with the girls, and we can sit and draw together. You have to really keep yourself engaged, Pinky. And whereas I never really fully, completely worry about those who are able, my worry is always for those who are not able. The person who is in that tiny little house that is one room and there's 6 people in that one room, I worry and fear for that person. Because in as much as we can talk about all these interventions, for them, it is something that is beyond them. And they will always be thinking, I just need to eat tomorrow. I just need to eat tomorrow. I need to get out and eat. So a lot of these people, we shall see, the escalated number of depression and anxiety that is going to come out of these people. And for me, that is always my focus. What are we going to do about it? And Pinky, now the conversation is how we're going to feed our Kenyans, because clearly the streams of money are slowly dwindling. As much as the government, I know, is grappling with, should there be a lockdown, should there be no lockdown, the biggest challenge is how do you feed Kenyans? As long as we have a feeding mechanism, then you can have a lockdown. But we don't have a feeding mechanism. And now more than ever, if Kenyans want to help each other, this is the time you need to now donate, give, find an avenue for giving. And it's amazing, Pinky. I've seen a lot of private citizens who've come out to give. Some have organized themselves into groups, and they're going around collecting whatever they can get, and then they can go and distribute. And that is a beautiful thing. Kenyans, this is a time to give. If you've never been one to give or to tithe in church, now you can move your tithe from church and give it to somebody who needs the food. This is really the time. And the other thing, Pinky, I've been telling Kenyans is it's also time for self-discipline. How are we going to fight COVID if we are not disciplined? And the least that anyone can do with or without food is be disciplined. So I'm telling Kenyans, if you've been told to keep a distance of 1.5, regardless of where you are or whatever you're doing, can you observe social distancing? That is a very easy thing to do, and it just takes your own personal initiative to do it. This is the way to help the government. If you're told to wear a mask, wear a mask. I mean, if you're told to stay home, for heaven's sake, stay home. Don't go for and party. This is middle class problems who feel they must continue partying.
Let's go for
Please
a coffee.
stay home.
Yeah.
Yes. Let us be disciplined and be patient. This thing it is going to pass. It is definitely going to pass. But it may leave us so broken. We don't have the capacity of other nations who are really struggling, and we can see them struggling. So imagine if we can't apply that little self-discipline that is being required of us and the patience that is being required of us, we will be left a completely broken nation with very little to pick up if we just can't observe self-discipline. That has been my message to Kenyans.
I also think that there, like with everything, with chaos, when the calm comes, beautiful things will definitely emerge. And I really think, with people like you definitely talking about mental health and pushing it, this will be something that will be on the forefront. And I don't think anyone in Kenya can afford to put mental health on the back burner, especially after this. So we really need to be able to take it seriously. Senator, are there any helplines, any websites, any people that if you're stuck at home, or if you're suffering, or if you feel like you need an out, is there any direction that we can sort of give people while they're going through this? Because there is anxiety, there's worry, there is, like you said, depression, and it's all come together. It's not just about one thing, it's so many things that go. But is there a place that we can sort of say to our fellow Kenyans, like you said, be your brother's keeper, yes, but also, is there any way where we can say, look, here is a support group, or here's where you can get some mental health direction in how to handle things and how to help yourself?
Pinky, from where I sit, unfortunately, I don't have that one place where people can go. But from my interactions with stakeholders, I know a lot of stakeholders who've formed these platforms where conversations can happen. And let's not forget the apps that are now currently present in Nuka and Bonga, where somebody can just log in and have a conversation privately and anonymously. Government, I know, have a helpline. They've been sending it around. I've seen it on WhatsApp. I've not seen it officially. I've seen it on WhatsApp, and it was sent to me from Mathare. I have not even tried it because I want to first engage with government, which we are about to do. Hopefully on Saturday, we shall meet with the CS and the National, Emergency Response Team, because I want to ask these questions to them, because I first need to understand what is their strategy on mental health during this time, because nothing yet has come to us in any form that I would say I can speak about it openly. So unfortunately for now, I don't have, but Kenyans should be encouraged to check all the other private platforms that have come up from different groups of mental health advocates who are really working hard at this time.
I agree. I've seen a lot as well, and I will definitely share them here. But we just want to say thank you so much, Senator. Despite whatever's going on, we appreciate your hard work, because it really is tough times. And like I said, there will be something beautiful that comes out of it. And it's only it takes warriors to fight battles. Yes. And, if it wasn't for people like you, we would really be in a bad space. So we look at you as light at the end of the tunnel. So we would just like to say thank you very much.
Thank you. And Vicky, just before we wind up, I have to say to our frontliners who are fighting in the hospitals and everywhere else where they are, frontliners, and we know the capacity of our government to protect them is challenged. Yes. We have to really do something about them. Their mental wellness, I think about that, and I'm asking the government, what are they doing for our people who are on the front line? Just today, Mombasa County, Joho was just speaking how the governor Joho was speaking how they're going to create a facility for isolation for COVID positive patients away from hospitals. And in his mind, he's saying this is to safeguard the frontliners, because one patient was taken to Coast General Hospital and it cost the hospital 8 nurses who got the disease. So you can imagine that kind of focus towards our frontliners. We need to see that from the government. and we have to thank them and pray for them every day for putting their lives out there, you know. And
Absolutely.
we need more Kenyans like that. We need more people to come out and help us. So we have to thank them. Every time we have these conversations, let's remember to thank them for what they're doing.
Yes. That's a great reminder. Thank you
Yes.
so much, Senator. It was such a pleasure talking to you as always. And thank you for being able to shed some light on this issue.
Thank you, Pinky, and also for your efforts and sending our voices out there. It's important. We also value you so much. Thank you, and continue with the good work.